We have some good news in the fight against the pandemic. There's been a dramatic downturn in coronavirus cases and deaths. Yesterday, less than 54,000 new cases of the virus were reported, the lowest number since October. 989 Americans were reported dead, the smallest single-day toll since November 29th. This comes after months of about 200,000 new cases a day nationwide. But experts say new variants could cause those numbers to spike again. Dr. David Agus joins us now. David, good morning. What concerns you most right at this moment about these new variants that we're seeing?
I think we're in a lull now because cases are going down, and these new variants are more infectious. That is, it takes fewer numbers of particles to create a symptomatic person with COVID-19. So as the variants rise across the country, and we're seeing them rise across the country, we are going to have an increase in the number of cases over the next several weeks from these variants. And it certainly is scary, the suffering that they could cause.
How significant an increase do you think we're likely to see, David?
I think it's going to be real. I mean, we saw announced over the past day there are 7 new variants in the United States, all of which have one point in common, and that's in addition to the Brazil, the South Africa, and the United Kingdom. So this virus is zigging and zagging. I hope we can zig and zag with it.
What do we need to do to zig and zag with it and try to hold it back?
Well, it's going to be, coming down to vaccines. So and our behavior, right? We need to double up on the masks. That's been talked about in high-risk situations, and really focus on that social distancing, not let our guard down. But the vaccines are going to be critical. I think of it this way, is that with the other strain, the first strain of COVID-19, you made an immune response to 10 points. Well, with these variants, 5 points have been lost. So the absolute number of antibodies and T cells is lower. What we do know now is that it's enough to protect most people from getting really sick and going to a hospital. But if the virus continues to change, I am certainly worried.
You're worried that the vaccine isn't going to protect people? Is that what you're saying?
No question about it. Is that right now they will. Every year we send strains to the World Health Organization, and they determine what goes in the flu shot. Over the weekend, the scientists across the globe, we were all on calls to identify a new database to do this for COVID-19. Because we know it's changing, and we have to predict whether we're going to need a booster or a third shot to keep those levels of antibodies and T cells high enough to protect against these variants.
You think a booster is inevitable, like by the end of the year?
I think either a booster or a third shot, again, to keep the antibodies levels high enough, is certainly inevitable. My gut is, it's going to be by the end of the year. We're starting now the clinical trials. They're going to be much smaller. The last ones were in tens of thousands of people. These will be in hundreds to show that it's safe and makes a good immune response. And then they'll be included, like we get a flu shot every year, we're going to get a booster.
Does this make it even more urgent for people to get vaccinated, David?
The sooner we vaccinate, the sooner we can stop spread of this virus and the creation of new variants. Yes, yes, and yes. We have to get vaccines into arms as soon as possible and not keep them in freezers for any prolonged periods of time.
Dr. David Agus, thank you so much for being with us this morning.